It's Dr. Cassie Smith, and welcome to Back to the Basics, a simple approach to health in the modern world. I appreciate you taking the time to join me today and hopefully learn ways that could help you improve your health. The modern world has left little time to focus on health and wellness. I hope to give you some quick and simple ways to be well and live your best life. Hello, and welcome to the next episode of Back to the Basics. I'm super happy that you have decided to join me today and continue our walk through this health journey that we're on and trying to better ourselves in life. So today I'm going to do something a little different. I had the privilege of going to Miami at the end of March and meeting this really, really cool guy. And we've been kind of collaborating online, but he is the CEO of Biohacks. It's a company that really is just dedicated to longevity and getting people really healthy. And so I've just been fascinated with his content, and I was going to be in Miami anyways. And so he was kind enough to have me to his office. It's a state-of-the-art office. It's going to be a lot like our new clinic. He has some awesome stuff, hyperbaric oxygen, cold plunge. He does a ton of videos where he's, in this icy water. And so he and I, we just kind of, exchanged brain power. And it was so nice to find someone kind of in my headspace and doing the things that modern endocrine is going to start doing. And so he and I just kind of went back and forth, and we had this conversation about hormones and just about biohacking and a way to be healthier. And so we just, we were just talking, but we ended up recording it. And I think it turned out really good. And so I wanted to use that content. And so what I'm going to do today is I'm going to play that content for you guys for this podcast. Now, I want you guys to go to where you listen to podcasts, whether it be Apple or YouTube. And I want you to subscribe so you get my content every week, please. It's going to come out on Monday. I need you to, share it. I want you to leave reviews. And then wherever you follow me on social or on that, let me know what else you want to know from Dr. D, because he's such a wealth of knowledge, such a fascinating guy. And he and I are going to do another podcast, and it's going to be pretty soon. We're going to record it. He also has this amazing wife, super intelligent, beautiful lady. She is a dentist, and she is a holistic dentist. And so she gave me some tips while I was there too. So they are just an awesome powerhouse couple. I love them, great people, and we're going to be collaborating with them a lot. But I wanted to go ahead and share with you guys what we did. So Dr. D is the CEO of Biohacks. It's an innovative company in the healthcare space that's pioneering technologies to optimize health, performance, and longevity. He's devoted most of his life to the study of human potential. His degrees include a bachelor's degree in biology, doctorate in medicine, master in business administration, and a research fellowship in general surgery in the Metabolic Institute at the Cleveland Clinic. Dr. D and the Biohacks medical team are known for contributing advanced studies, research, and papers that continue to push the edge of medicine with profound positive results. He founded Biohacks because of his own personal journey, where he learned to successfully biohack his systems in order to overcome a serious illness. Now, when he's on my podcast, we can talk about that. I know his story. From his personal wellness success, he self-funded and built Biohacks brand. Biohacks customizes health and performance plans tailored to each individual's unique makeup. Dr. D continues to expand the Biohacks brand by doing global speaking engagements and educating the world about topics like epigenetics, human performance, longevity, hormone optimization, heart disease, and so much more. So I hope that you guys can see why he and I meshed. Such a wealth of knowledge. So I'm going to play for you what we recorded. And then please remember to share this, follow us, like, subscribe, and let me know what you want me to ask him whenever he and I collaborate again. I'm also going to have his wife on, the holistic dentist. So if you guys want to ask any sort of questions about that, let me know as well. But without further ado, our little conversation that we had in Miami about 6 weeks ago is coming at you.
Yo, what's up, everybody? Time for another podcast. And today I am super excited. I'm here with Dr. Cassie Smith, and I've never met somebody like you. She's an endocrinologist, board certified endocrinologist, but she actually thinks very different about medicine. We just had an awesome conversation about just medicine in general and just the whole landscape of how things are nowadays. And I'm like, I literally told her, I'm like, I didn't think we would be so aligned. We've been following each other for a little bit.
Yep.
And she flew in. We're getting to spend some time together. And I just want to thank you for coming through. It's an absolute pleasure.
Thank you for having me.
So I'd love for everybody to get to know Dr. Cassie. So Doc, where are you from? Where'd you grow up?
Good questions. So I grew up in a small town in Missouri. It's called Lebanon, Missouri. Kind of like the country, but very small town. Grew up, and I decided really quickly I wanted to leave because it was very boring. But I wanted to be a doctor whenever I was younger. I knew that. I loved helping people, and I remember thinking, like, there's so many sick people, and I just want to figure out how to educate them and make them better. So I left, and I went to med school at the University of Missouri, Kansas City. It's one of 3 med schools in the country that is a 6-year program.
No way.
Yeah. So there's
wait. I didn't even know this. There's 6-year programs?
So I went to one.
No.
So right out of high school. So I was 18. And you do undergrad and med school combined.
Get out of here.
It's tough. You do like 24 hours in the fall and spring and then like 12 in the summer. But your 3rd year, you're kind of starting med school and you do rotations and you have a clinic that you go to, and it's intense.
So you were prescribing like at 26 or something like that?
I was done with med school at 25.
20, wow.
Yep.
Wow. I finished at 30.
Yeah. So I went there and I got really good training. And then I decided, okay, I want to do internal medicine, right? Because I want to help people be better.
Of course, yeah.
So I went to residency there. It's underserved hospital in Kansas City. And so I did my residency. And then I decided, okay, I'm going to stay and be a chief resident. And I started practicing. And so I was seeing patients in the clinic. I was going to the hospital. And for a year, I was really frustrated because nobody was getting better. So, I'm that person that, like, if you tell me to do this and this, I'm going to do it, right? Like type A in med school. Like, so I did exactly what they taught me in school. And for a year, nobody got better and everyone was getting worse. And so I was like, maybe I just need more training, right? So I was like, diabetes was one thing that really like sparked me, diabetes and thyroid issues, PCOS, because I had some autoimmune stuff. And so I was like, I'm going to go learn how to be an endocrinologist, right? I'm going to go get more training.
Wait, real quick. When did your stuff happen? Was it around that time, before?
So whenever I was in med school, I developed Graves.
Ooh, tell us more. I want to know about your story. Go.
So I'm in med school and I'm, studying and I'm not eating well and I'm doing all the things everyone does, right? I don't sleep well and I'm eating McDonald's and I'm staying up drinking energy drinks. And I remember sitting there and like my heart's like, and I'm shaking and I'm like, oh, I just had too many energy drinks. Well, it didn't stop. And so I actually went and did blood work and they're like, oh no, you have Graves. And so I'm like, what is that? So I'm kind of like reading about it. Okay, I know what it is. But they say, well, let's just kill your thyroid. Let's just give you radioactive iodine. And I was like, that doesn't seem like a good idea. Yeah. And so cool. I kind of read a little bit and I go back to them and I'm like, there are other options, right? And they're just like, no. Let's just kill your thyroid. And I didn't like that. And I'm going to the endocrinologist at, where I'm going to school and this is a training center and they're just like, yeah. And so right then I was like, interesting. And so I did some more reading and I realized there's other ways that you can fix this, thankfully. And so I changed my life, right? Started sleeping better and eating better and to some extent. And so it got better. It went into remission with some medication, thankfully. And so then I kind of finished med school. I'm in residency, came back in residency because I wasn't sleeping well and I was on ICU overnight. And so I get another flare of Graves. Again, let's just kill your thyroid.
Right.
No, that's not a good idea. And so it went away. And then I finished residency and then I decided, all these people, we're supposed to give them all medicine. They're supposed to get better. They're not getting better. And so I decided I'm going to go learn more about endocrinology because I never got the answers that I wanted as far as like thyroid disease. And I had some issues with hormones, PCOS. And so I'm going to go learn about that, right?
So you had PCOS at the same time with the
I had PCOS, although I never really got diagnosed. Let's talk about this, women. I had hormone issues, right? I had hormone and weight issues. And so I had irregular menstrual cycles my whole life. And doctors would just say, oh, well, that's just, you're stressed. You're not sleeping enough. You're in med school. We'll just give you birth control.
That's always the answer.
It's birth control. Because, I was like, I have these mood swings and I don't feel well. And it was always, your lifestyle. And it was just birth control. But as I look back, the other symptoms I was having, right? I was having painful periods. I had cysts on my ovaries with an ultrasound.
Okay, I was going to ask you, you should ultrasound. I think it's more than 11 cysts
Yep.
per, and there's none of that nowadays. Just here.
And they're supposed to do blood work.
Yeah.
And I was having acne issues. I had all the symptoms, but it was like, oh no, you're fine. Just take some birth control. And so that happened to me whenever I was in my teenage years. And then whenever I was in med school, and I never really thought about it or figured it out until I got into my 30s, because I started having more hormone issues in my 30s. So I had all that going on, but didn't really know what was going on, right? And I never really got good answers. So I'm finished med school, I finished residency, and I think I'm just going to go get more education so I can help people like myself. So I went to the University of Oklahoma because they have a big diabetes research program. It's called the Harold Hamm Diabetes Center. And I thought, I'm going to go learn about all these new great drugs. This is when Ozempic was coming out.
Yeah, the GLP.
So I helped to do a lot of stuff with GLP-1s. This is when like Jardiance was being studied. So I thought, I'm going to go learn all these great things about these medicines that are going to help cure everyone, right? So I go and I spend 2 years and I do a bunch of research, and my thyroid starts acting up again while I'm in fellowship. And I'm asking all these doctors there, and nobody gives me good answers. Like, I'm like, why is it happening? Like, what can I do to make it go, get better? Now I'm actually hypothyroid. So instead of hyper, I got Hashis. So I got Hashimoto's. And so my question to them is like, how do I make it go away? What can I do to make it better? I don't want to take medicine. I don't want to have it taken out. And everyone's like, what are you talking about? Like, you take the medicine. Like, there's nothing else, right? And I was like, that wasn't a good enough answer for me.
Right.
And so I start studying and reading, and I find all these little things, but I kind of just stopped because everyone's telling me like, no, that you just take medicine. Like, that's not right, And I'm in this fellowship, right? This board certification fellowship. And everyone's telling me, no, you just go off these guidelines and that's how you treat it. So I get through fellowship, right? And I'm learning about GLP-1s and I'm learning about thyroid. And so I get out of fellowship in 2015. No, 2017. And I go to work for Mercy Hospital, which is like this big, institutionalized hospital. And so I'm like, okay, I'm super, like, I'm smart. I know what I'm supposed to do. The guidelines say you put diabetics on these medicines and you check this, and thyroid patients you put on these medicines. And when their labs are like this, they're fine. And so I do everything that they taught me. Now I have like 15 years of education. And a year in, I'm like, nobody's getting better. Mm-hmm. Everyone still feels like crap. Nobody's getting better. And it was frustrating because I have these people that keep coming back and they're like, Cassie, I don't feel any better. Like, I feel terrible. But their numbers and everything I was taught in med school and in fellowship is like, they're fine. And so I started feeling like a failure. I'm like, I can't help these people, and it bothers you if you really care about people. And so I started doing a little bit of other research, and I start finding out this world of functional medicine, right? There's this whole world out there of these doctors that people say are, quacks, lunatics, whatever, where they're actually, looking at T3 levels and looking at how thyroid converts and different things. And so this went on for about 2.5 years. I worked for this hospital system, was very unfulfilled with life, was very sad. And then right before COVID, I told my husband, I said, I don't think I want to do this anymore. Like, I think I want to start my own practice, and I want to look at other ways to treat people. And so on March 1st of 2020, the worst time in 100 years to start your own practice, I quit my job and started my own practice to be an endocrinologist. But it ended up working out great. So I think if you're doing the right thing and what you're supposed to, God takes care of you.
Absolutely.
And so thankfully it was fine, but I started my own practice. I started doing a lot of functional medicine research. I got hooked up with a company called Bioidentical, which does bioidentical hormone replacement. And I just started researching hormones and how they work in the thyroid and insulin and cortisol and how it all works together from a functional medicine standpoint. And so I started that in 2020. I've been doing that now for about 4 years, but it has changed my life, and I think the life of a lot of my patients.
Yeah. And I'm going to tell you, as a fellow colleague and somebody in the industry, I've never met an endocrinologist like you. I started following you, and I'm like, I remember watching your post. I'm like, wait. Did she just say something that I actually really agree with this? And then I went another post and another post and another post. I was dying to meet you in person, which we just met actually a few minutes ago. And I mean, she's talking to my wife, which is a holistic dentist, and they're jamming over there over some science and stuff. And I'm like, oh my God. It's like, we've never met, completely different areas of life, whatever, both studied medicine, but then all of a sudden when you start actually, it's not studying, just functional medicine, biohacking, regenerative medicine. When you actually get to understand how the body works and you go back into physiology, and it's like, wait a minute, and you start thinking a little bit outside the box and you start looking at the resources the body needs, which in medicine, they don't teach us that, the vitamins, the minerals, all this stuff. And you unequivocally start to fall in the same line, and then you start to run into the same other people like us running into each other saying, oh, hey, hi. Yeah. It's like, we think the same. And there's an ever growing community. So thanks for sharing with the whole, the thyroid thing. And just for listeners, she went through, hyper and then hypothyroid, which is crazy.
I've seen the whole spectrum.
Yeah. She bounced around. And I know there's people out there that, are going through this or have gone through this. I've had my own challenges that I've talked about in other podcasts, but, never with my thyroid. And then also PCOS, which PCOS is such a popular thing. What would you say is one of the most common things that women come to you for? Is it the PCOS? But which label is it? Which label do they get hit with?
Chronic fatigue and weight gain, right? But so most people come to you, and you know this, right? Like, I'm tired, I want to lose weight. I'm tired and I want to lose weight and I want to lose weight. But when you start looking at why is the body breaking down? Like you said, like for me, it's really cool because I actually understand hormone metabolism really well now because of fellowship. But when you take it back to the very basics of cellular metabolism, it's all about energy for the cell, right? So it's all about ATP. And so if you don't have ATP or you can't make ATP for your cell to function, then you don't feel well. Things start dying. Well, why can't you do that? Well, because of chronic inflammation. Well, what causes inflammation? Well, it's our lifestyle, right? And so if you don't have the things that you need, the micronutrients, the hormones, or they can't get into the cell because of inflammation, or because you don't have the cofactors for them to get in there, like micronutrients, then you can't make ATP, then that cell's not going to work. Then it's crazy to think that our body's going to work, right? Because at a cellular level, just your one cell in that organ can't even work.
Absolutely.
And so that's kind of when you start putting all that together, it's like, oh, okay. And then you realize cortisol is a huge inflammatory molecule if it's unchecked, right?
Of course.
There's a point for cortisol, but most people's cortisol is out of whack because of our lifestyle choices. Same thing with insulin. And when your cortisol and your insulin are not where they're supposed to be, it affects your sex hormones. So your estrogen and your progesterone and your testosterone. And then ultimately that affects your thyroid. And oh, by the way, so and it all plays together. Our guts are huge issues in this country, right? So if your gut's not healthy, then it's crazy to think that your thyroid's going to be healthy or that any other hormone's going to be working correctly, because we absorb all of our micronutrients from our gut, right? And I tell patients, we eat usually 3 times a day, right? So you have a choice 3 times a day of whether you're either healing or harming your body.
Absolutely.
Every time you put something in your mouth. And most people are harming their body, causing inflammation. That inflammation is, systemic. And then it's crazy to think that, okay, now we have this systemic inflammation. We don't have our micronutrients. So then how do we expect our body to function or run correctly?
Absolutely.
If we can't get what we need into the cell? And they all play together.
You're talking, and I'm like, oh my God, she's the right person that I've wanted to have this conversation with. And let's start going deep is, people see hormones as the isolated, my testosterone, my estrogen, my cortisol. And I'm like, guys, this is so connected. It's an environment, like one is off. It's like a domino. You hit one hormone off, but guess what? That hormone's getting hit with some lack of resource, call it micronutrient, vitamin, like we were talking about the thyroid. Right. Take selenium away from the thyroid and see what happens. For example, take zinc and whatever, and then beyond that, what can be taking away, for example, the iodine, for example, for the thyroid, the toxic halides with the fluorides and so forth. So it's this cascade of things. And people are like, oh, I got my hormone replacement therapy. I'm like, all right. But that's why when people ask us, are you a hormone clinic? I'm like, whoa. Not really. I'm like, that's not exactly what we do. We're going to check you head to toe, starting with environmental. We spoke a little bit about it before. I love environmental toxins. It's just environmental toxins. If we're talking about a cascade, they almost kind of come a little bit first to me, because it's like, sure, I can check all your hormones, but what's causing all the problems? You're getting poisoned a little bit every day. I tell the guys all the time, like, you're getting castrated every day, buddy. I hope you know that.
Yeah, if you don't clean the poisons out, then you're going to have the inflammation. So it doesn't matter what you put in, it's not going to work.
Absolutely.
Yeah.
Absolutely. And then, there's a big movement, especially online. And I'd say a lot of the academia guys, they're reading papers all day, not talking to real people.
Or practicing medicine.
Right.
We're actually seeing what happens in the real world.
Exactly. I mean, and it's like, where there's a defense of, it's okay to have your fair, just a little bit of Doritos here and there, a little bit of, and I'm like, okay, the little bit of the premise of the toxicology, the dose makes the poison. I'm like, yeah, but nobody knows you're getting hit with some little bit of toxic water from your shower, a little bit of toxic food, breathing in a little bit of that, getting hit with a little bit of radiation of that.
Putting it on your body with all our creams, and putting it on our face with our makeup, and brushing our teeth with our fluoride toothpaste.
Exactly.
Like your wife had that great post about.
Yeah, she posted about that yesterday. She had, lovers and haters to
Well, I'm a lover.
So it's like, it's a constellation of things, right?
Yeah.
I mean, and
before we even get to food, like, it's everything else you're breathing and putting on, and
now women with what are your thoughts on, I have to ask this one. I never had the opportunity to ask this to a female endocrinologist, birth control.
Yeah. So I hate it. Hate it.
Let's go.
I was put on birth control when I was younger. I was on it for a really long time. I didn't get off of it until my 30s, and it did a lot of really bad things to me. And I see it in women all the time. So I would say young women from 18 to 35, I see them all the time with elevated cortisol levels. And the number one reason is birth control. Boom. Number one. And I can prove that through testing. So you can prove it through, testing that you do for hypercortisolism. And then
you do salivary, or
I
what do you
prefer? I do all three. I do salivary, I do urinary, and I do a DEXA suppression.
Oh, you do DEXA?
I do DEXA suppressions because this is how you find them with a DEXA suppression. So if somebody is on birth control, what will happen is their salivary is usually normal, their urinary is usually normal, their DEXA suppression is equivocal, meaning, so if it's normal, it's less than 1.8. If it's abnormal, it's more than 5. And then there's this gray area we call equivocal between 1.8 and 5, which is like, it's not normal, but they don't have Cushing's or a disease process. It's birth control. And so you'll DEXA suppress these girls, and their cortisol will be 3.2, 3.7, 4.1. And then you take them off their birth control for 3 months and you do it again. It's normal.
No way.
I see it at least once a week.
No way.
And so that's what's frustrating to me, especially with PCOS. So this was the game I played. I made a post about this morning. When you have PCOS, the treatment is not birth control. At least it shouldn't be. That's what they teach you in school. They teach you in school, tell these girls to lose weight, give them metformin, and put them on birth control. And that's because we want to try to regulate their menstrual cycles.
Wait, I got to interrupt you on this. When in med school, you just had metformin, which is a diabetes medication. It's like, this happened to, metformin, we're talking about ovaries, diabetes. Whoa. That never really, in med school, that was one of the things I went up to my teacher. I'm like, wait, birth control? You just said I could treat this with a diabetes medication, but I give birth control? I'm like, I'm very confused here.
Yeah. So the thought process is metformin helps with insulin resistance. So when you have PCOS, you're very insulin resistant, right? And again, and we're just going to throw meds at you. We're not going to fix the problem. We're not going to talk to you about diet, or God forbid we talk to you about, let's fix your hormones so that if your estrogen, progesterone, testosterone are balanced, you don't have insulin resistance and you don't gain weight. We're just going to throw medicine at you.
Right.
So the thought with birth control is it's going to normalize your menstrual cycles, which is what you want, right? You want to normalize. The thought process is if you have normal menstrual cycles, your estrogen, your progesterone, your testosterone are all going to cycle normally. And then you're not going to have these terrible symptoms like, the PMS symptoms and the bloating and the weight gain. But birth control, what it's really doing is just chronically suppressing your body's ability to make estrogen. And you want estrogen as a woman, like real estrogen. It's the best, like
bones, everything.
And so you're just chronically suppressing women's estrogen. And so what is that doing? It's making us crazy. I mean, it makes our moods insane. And so it makes you depressed. It makes you anxious. It's terrible for your bones, right? So we're supposed to be making bone and getting to our peak bone health from 18 to 25, 26. And we're suppressing all these girls' estrogen. So they're not even reaching their peak bone mass. So then when they actually are older, they're going to become osteoporotic and they're going to get a fracture. So right now in this country, about half of women develop a fracture, an osteoporotic fracture, before they die. Mm-hmm. And 29% of those women will die the first year after their fracture of infections, UTIs. It's a big deal.
Wow.
And we're causing this a lot of times with birth control. And so that's not a good way to treat it.
I have not seen papers on this. I have this whole theory. We just had a little baby boy about 2 years ago, ramping up for the next one. And, it's like, how do I get my wife as healthy as possible? And I remember we were at this conference. I can't remember which one. I think it was A4M. And they had this machine there to test micronutrients. I mean, the conference was packed. Those like rooms where they have all like the toys and you just look kind of up and there's like a ton of heads, like it's packed. And then my wife tests on the machine and the lady's like, oh my God. She's like, you just scored the highest. And it was like day 4 of the conference. So a lot of people had run this. She's like, you just scored second highest out of everybody in the conference with your micronutrients.
That's
and
awesome.
she was like 8 months pregnant. She was like, big girl. And I was like, yes. I was so excited for that because I'm a firm believer. And Germany has some studies on this. I forgot what organizations. I think some kind of federal organization in Germany. We have the studies saved here. How things like omegas, iodine, magnesium, vitamin D, etc., impact the IQ of the baby. Mm-hmm. So now, if birth control will deplete women of micronutrients, for example, something that's classically, right, it kills them with micronutrients.
And estrogen, which kills your gut, by the way. So when your estrogen's low, the microbiome in your gut changes as a woman, and that causes a lot of symptoms. Did you know that? So when you deplete a woman of estrogen, her gut bacteria will change significantly, which is not good. So
estrogen and microbiome, there you have it. Yeah, that's actually a topic. I've heard some strokes on that, but we're gonna have to go deeper on that one. That one's super cool. But yeah, so
and to prove your point, part of the reason your wife probably tested so well when she was so pregnant is because her estrogen was through the roof. When you're pregnant, God makes you away for a reason. So when you're pregnant, your estrogen's high, your progesterone's high. And this is why typically women, when they're pregnant, they're like glowing, right? Like they're massive, but they're like, I sleep good, I feel good. Because they have really high estrogen and progesterone levels. And they have some testosterone too. So her gut health is on point. She's absorbing all her nutrients. She's loving life. And what is crazy is that doctors tell women now, once you go through menopause, you don't need hormones. They cause cancer. They kill you. Are you kidding me? They're like the highest ever when you're pregnant. Like, how are we telling people like hormones kill you? Like when you're pregnant, your hormones are through the roof, right? Yes. And so that's probably why her micronutrients were so good, because her estrogen was crazy, her progesterone's crazy. So her gut flora is great. It's absorbing, and she eats well.
Yeah, she was literally on shots of micronutrients. I was watching her micronutrient profile and absorption, in the cell and out of the cell. So I was really on top of that. And I'm not trying to be that dad that's like, oh, my son's like, but he's talking. He has a lot of words for her. I'm like, I'm not doing exactly. I lost track, but I'm like, he's not even 2 yet. He's putting little sentences together and stuff like that. So I'm like, oh wow, but so I think that counts a lot. With the whole balance of things. That like birth control, for example, being a I'm going to associate it to a strong word, a toxin that is removing resources that your body needs to actually function properly, right?
Yeah.
And there's just a slew of other things we're exposed to on a day-to-day basis that causes that. But now that you touched on something I was going to ask you, do hormones cause cancer or do they not, right? Yeah. Because I can't tell you how many times I get that question. We get whacked with that. Mm-hmm. That's the proper word, whacked, because it feels like the same question over and over. And even other on our social media DMs, other doctors saying, no, hormones cause cancer. And I'll just tell you my short answer to everybody. I'm like, look, you have two beautiful chemical events in your life, biochemical events in your life. One's called puberty.
Yep.
The other one's called menopause or andropause, right? Which one has the highest level of hormone and so forth? It's you have by definition, puberty, I mean, you'll tell me if I'm right or wrong, is a surge of hormones that changes your physiology and right? And then the years that ensue right after tend to be your years of highest energy, flourishing through life. You're hitting your things on your vision board, right? Your life's going good. And tend to be the years that you have less incidence and prevalence of cancers and so on and so forth.
Correct.
Versus after the second biochemical intervention, menopause or andropause, depending on who we're talking about, then there's a higher incidence and prevalence of cancers, heart disease, and so on and so forth. And I never actually talk about the pregnant example. You know, you have a surge of hormones. I start with that, and then go down the rabbit hole and crucify Premarin a little bit. We'll talk about that.
Yep, that's where it all came from. People, a study where most women were 62 years old and they were on a synthetic hormone called Premarin, and it's not a fair comparison.
Absolutely.
Yeah.
So, what are your thoughts on hormones and cancer?
So, my thoughts are that hormones do not cause cancer. They're actually very beneficial, as far as keeping you from developing diseases like you said. Did you know, actually, I was telling your wife this, we're the only mammals that live on land that go through menopause. So whales go through menopause. There's few that live in the ocean, but most mammals, once they lose hormones, die. So we are the only people that have outlived our life expectation after hormones are gone. And if you think about it, it makes sense, right? Like people used to die at 49, 50, 51, but now that modern medicine has gotten better and we've beat disease processes and we have better, food sources and things like that, we live 30 or 40 years after we lose hormones. But there is not another mammal that is walking on the earth that outlives hormones. And so so when you have hormones, you are much healthier, right? When women go through menopause, their cholesterol goes up. Their blood pressure goes up. Within 6 months, drastically. You're 3 times more likely to get high blood pressure 6 months after you develop menopause. You start losing the protective benefits of estrogen on your heart. And so like the fact that people say hormones cause cancer, well, estrone, which is a type of estrogen, which is made in your fat cells, which is why adipose tissue is an endocrine organ, right? So I tell people this all the time. If you have a lot of adipose tissue, it's bad. It converts your hormones to estrone. Estrone has a 5 times affinity for the alpha receptors in your breast. Alpha is awful. Alpha is what causes increase in BCL2 and it causes breast cancer. So I test women's estrone levels, especially when they're obese. If they want to talk about hormones with me, I can pinpoint people that are going to get breast cancer. It's women who have high estrone levels and they usually have obesity. So, your number one risk for cancer is age and weight. But hormones, it's not fair to say that hormones cause it, right? Estradiol, the good form of estrogen, that's not what's causing cancer. Like it doesn't cause cancer. It's estrone can, but just like you said, it's crazy to blame hormones on this. And so there are certain people there are a very few amount of people that are not hormone candidates. Like I even give certain people after breast cancer, after, hormones. And so it infuriates me. And I get these people who come to me, I'm sure you do too, like this lady's trying to kill you. Other doctors tell my patients, she's trying to kill you because she's giving you hormones and yada. Are you kidding me? Like the only study that was out there has had multiple studies published after it that shows it was not a good study. And no, I'm not trying to kill you. I'm trying to protect your bones and your brain and your heart and make you not have vaginal dryness and chronic urinary tract infections and not be, depressed and anxious. And so it's very frustrating.
Absolutely. And when you look at hormones causing cancer, I tell people sometimes, they do cause cancer if they're not bioidentical. And if it's like, Premarin.
Premarin.
Yeah, like Premarin, for example, which actually stands for pregnant mare urine. So horse urine. They actually have a bunch of horses, and they're collecting the horse's urine, and I don't know the exact pharmacological process, but from that they make the medication, right?
Right.
And Now you give that to women, that causes a problem. And if I haven't read this in a while, but I think it's flipped. Instead of being like estriol 80-20, I think it's the opposite because the mares, I think it's something like that. I think it's estriol 80, estradiol 20. Just that is a problem.
Right.
Then the fact that the darn thing's not bioidentical.
Well, the problem with progestins are they block testosterone receptors. And our testosterone receptors as a woman actually downregulate alpha cells in your breast. So if you have a lot of testosterone as a woman, you'll have less alpha receptors, so you're less likely to develop breast cancer. Progestin goes and blocks that testosterone receptor, so you get more alpha receptors in your breast. Progestin, not micronized progesterone. But I think that's where the issue was in that study, is progestin downregulates testosterone, upregulates alpha receptors, increases your risk of BCL2. When then you get all these other toxins flowing through your body, your cells start to mutate. When our cells start to mutate and make cancer, our body's supposed to come in and fix that, right? But if you have a bunch of BCL2 floating around, that's like food for the cancer.
Of course.
And then you've got all this inflammation from toxins and insulin resistance and cortisol. So your cells can't get to it to eat that up. You get cancer. So it's progestin is downregulating testosterone.
And then we're trying to find the cure to cancer. Magic pill. Everybody wants the magic pill. Mm-hmm. It's like, no, it doesn't work that way. Same thing with now in our community, the longevity community, they're trying to find a magic pill to make people live longer. I'm like, guys, no, wait, stop.
Inflammation. Just stop the inflammation.
Exactly.
Right? It's cell death.
What we're doing ourselves, all this engineering of these technologies and so on and so forth, causing the problem. So yeah, on hormones, I'm a big fan for my personal life, my parents and my in-laws. You just see a difference. Like you look at a family picture of us, especially before I got into all this stuff, call it 7 years ago. And you look at everybody now, I'm not going to say everybody looks younger. Okay. I'm not going to be like 7 years. You could tell, but you see everybody's figure, you see everybody's mood, you see everybody's energy. My father-in-law, he really likes cars. He's like, he comes up to me. He's like, oh, I could wash my car now. And the other car, I washed 3 cars in a day and I feel great and so forth. And he's like, I couldn't do that. He's like, I was done. I was on the couch. He's like, what the heck? Yeah. He doesn't really understand what we're getting. He's like, what is this stuff? He's like, this is good for me, right? I'm like,
and hormones, I feel like people put it in a big basket, like hormones are bad. But like you said, they're different types of hormones. There's synthetic, there's bioidentical, there's estrogen, there's 3 different types of estrogen, right? There's estriol, there's estradiol. So it's crappy that it all gets put in this big bag because that's not how it should be. There are better ones. And to your point, my dad is a great example of this too. So in 2020, he had quadruple bypass surgery. He smoked. He had a past life where he maybe didn't take very good care of himself. But since then, yes, he had quadruple bypass surgery. And yes, I have him on hormones. Yes. And I'm not trying to kill my father, I promise. But if you look at him now, I have my people in my clinic come up to me all the time and they're like, your dad looks so good. He's turning 70 next month. He looks so good. Like he's lost all this weight. He's taking care of himself and he's on hormones. Like his testosterone, and he'll tell you I feel great. Like he feels better than he's ever felt. And so you're right. It's taken 3 or 4 years, but he feels better. He works too much, but he feels good. And he looks so different. It's insane.
On the older guys, it's funny because they'll come in, sometimes with the wife, and the wife's like, oh, this is Harold. Harold's grumpy. And he's getting lost now all the time and whatever. and then it's like you give Harold, some little cream or whatever that you're going to choose, maybe a pellet or whatever. And then the wife comes back. Oh, he's in a better mood.
Yeah.
And he's like, oh, I think I'm finding myself around the neighborhood.
And then 3 years later, they're like, all right, you got to stop giving Harold the cream. He's chasing me around the house. Or you got to get the wife on something.
Absolutely.
That's what happens with me. They're like, what are you giving him?
Absolutely.
He's like 20 again.
I know. And you see a huge difference now.
Yes.
That actually reminds me because one of our clients the other day, he's like, wait a minute. He's like, women could take testosterone too? I'm like, well, yeah. I'm like, of course. And he's like, wait. It does the same thing it does for me? I'm like, well, it's very different and so forth. But, so what are your thoughts on women and testosterone replacement therapy?
Yeah, I do a ton of, I would say in my practice, probably 75% of my hormone patients are women. And then 25 are men. I'm getting more men, but I do a ton of hormone replacement therapy in women. I take testosterone. It is a needed hormone. So it is very needed. if your levels are low, right? So it helps with maintaining muscle mass. As we get older as a woman, we lose muscle mass. What is the number one reason your insulin goes up and you start gaining weight and become insulin resistant? You lose muscle mass. So as you lose muscle mass, that's not good. So testosterone helps with that. It helps with your mood. It actually helps increase dopamine and serotonin. It helps with energy, right? It helps with blood flow to your brain, helps with blood flow to your heart. I mean, so I do use it. I don't use it maybe in some of the levels that there's a lot of different people out there, right? Some people, say, oh, you should be 200, you should be 300, that's not necessarily what I do. It depends on the patient and what symptoms they're having, but I do a ton of blood tests. I like Bioidentical. If they're having side effects, we cut back the dose. Like, I'm not trying to make you, like a man. But I think testosterone is very needed in a bunch of women, a ton of them. It's part of why a lot of them feel bad. It's why a lot of them are having issues with weight gain. It's why a lot of them are having mood issues. It helps a lot with libido as you get older, right? So you don't learn anything about female sex drive in med school, right? Like, if somebody's complaining about that in med school, they're just like, oh, well, you can't talk about that. Like, women aren't supposed to talk about that. Well, it's a real thing. Like, women
are we taught to prescribe anything?
No,
there's nothing for women's sex drive. There's nothing.
No, that's what they tell you, right? Like, it's not like I don't know. That's
maybe an SSRI.
SSRI, because they're whiny. Like, they're complaining. Just give them an SSRI. No, it's because they lost their hormones, right? And so it's an important part of life, right? Your mood and it's an important part of relationships as you get older. That's what I tell my patients. Like, it's very important. And so it helps with that as well. So it's not just that though. Like, a lot of these pop-up clinics and things that, HRT, whatever. I think that's kind of what they target, right? Like, oh, libido.
Yeah.
And that's great. And I want you to have libido, but I want your brain to work. I want you to have blood flow to your brain. I don't want you to be demented. I want you to have muscle mass. Like, that is the most important thing as you age, muscle mass, blood flow to your brain, things like that. So I'm a huge proponent of testosterone.
Yeah, and what you're saying too, like, you can get testosterone at a pop-up clinic.
Yeah.
Or
and then I have to deal with the mess afterwards.
Yeah, that's why when some people say, oh, you're a hormone replacement therapy, no, we're not. Sorry. No, we do medicine, right? And like I said, checking everything from environmental toxins, keeping people as far as possible from cancer, heart disease, and so forth. And, let's get into a little bit of fitness, because we both like fitness, right?
Yes.
And
it's a new segue in my life. Haven't always been like this.
Oh, really?
Well, so I was telling your wife, women, like, this is what we're taught, right? So when I started gaining weight in my younger 30s and started having my hormone issues, I was like, oh my gosh. And so what did I do? I did what every other woman did. I stopped eating and I started running for like 2 hours a day, right? So you starve yourself and you run, because that's what you're supposed to do.
Didn't throw a GLP in there too?
No, I actually didn't whenever I was younger. And so what happened was, I did lose weight, but I was like this skinny little, what society says is what you're supposed to be, right? Like, I weighed 115 pounds. I had zero muscle. My husband will tell you, he was like, you looked sick. And so that's what I did. And then as I learned more and more about, so I actually had PCOS and my insulin levels were high. Even though I wasn't overweight, I had high insulin and I had PCOS and I was having all these hormone issues. And I'm like, how does this make sense? Like, I don't have adipose tissue per se. Why am I insulin resistant? Well, I had no muscle, like none. And so I'm like, okay, and my cortisol was high, shocker, because I'm running, right? I'm starving myself. I'm doing all the things you're not supposed to do. So my cortisol is through the roof and my insulin's high. And even though I look healthy, I'm like, metabolically, I'm not healthy, right? And so I'm like, okay, I got to start lifting weights, because I'm getting into this space where everyone's talking about weight and muscle, and it makes sense. The more muscle you have, the better you can utilize glucose, your insulin levels go down. So I didn't really start lifting weights until probably I was 33, 34. So probably till about 2020, 21. And I was like, okay, I'm going to make some muscle. And it's hard, by the way. So I love when women are like, oh my God, you're going to put me on testosterone. I don't want to bulk up like a dude. I've been trying to bulk up like a dude for 3 years, really dang hard. And guess what? I've maybe made like 12 or 13 pounds of muscle. But
I'm kind of good at that. We should work together.
Okay. Maybe you and I would love the tips. So it's important. So I did, I got into this space of, okay, I'm not going to run. I'm not going to kill myself. I'm going to start trying to make muscle. And it is crazy how different you feel.
Oh, absolutely.
Right.
Absolutely.
It's insane. And it's so empowering as a woman too. Like, I don't know. It's just something about like you go in a gym and you lift things and you start to see changes in your body. And we've got to change how society looks at women too. Like these women on magazines that are like stick figures that are like, those women are breaking their hip. They're not living very long. They're depressed. Like they're doing
no. That doesn't make
like
any
you
sense.
need muscle. But yeah, let's talk about it. Like the last 3 years, I've been all in that space, and I would love for you to help me make some more muscle. That's what I was talking to your wife about. Like, yeah, my goal is to have as much muscle as possible, because as I get older, you're going to lose some muscle.
Absolutely.
And I think the most metabolically fit humans that I see are people that have a lot of muscle.
Yeah, no, I mean, keeping, by definition, when you age and you're losing muscle, you go through cachexia, right? Like you're just breaking yourself down. I mean, it's a state, right? Or sarcopenia, sorry.
Yeah.
That's a state that attracts so much unhealth, right? But with something I see now in the hormone space with these GLP-1s coming out, which they have for example, on heart disease and so forth. We had our cardiologist here last week, and we were talking about like he sees a lot of good stuff on the heart side
because of inflammation, because it shuts down inflammation.
Absolutely. I mean, and I'm not per se against them or anything like that. Everything has not everything. The GLP has its place, I think, on the specific person and so on and so forth. GLP-1s. But there was something I see people doing now is like just GLPs, and then you get skinny fat and you're getting tiny, and these older ladies, I'm like, no. I'm like, what you're doing is wrong. I mean, and that's where, again, are you a hormone clinic, weight loss clinic? No, we do medicine, right? I tell people all the time, because the thing is, I love DEXA scans. Number one thing I say, okay, your weight loss, grab that scale that you have, take a nice baseball bat, or throw it out the window, break that thing. You're not going to stand on that. Oh, what am I ever going to do? You're going to use a DEXA scan. You know what a DEXA scan is? And we find a person, DEXA scan for them to use. And then our clients were really successful in muscle mass going up and fat mass going down. And then I constantly get the comment from the ladies, and this is more a word, actually pretty much exclusively women will tell me, oh, I feel more toned. I feel tight. They say this word tight. I love it when they say, I feel really tight.
I feel good in my clothes.
They say that again?
I feel good in my clothes.
Yeah, like, exactly.
And that's what I call it, the cry box. I'm like, I tell people all the time, I don't care what number is on the cry box. That's why I made that post a couple weeks ago, because people are always like, I want to weigh 120. I want to weigh 120. We have this number in our head. And so I made a post a couple weeks ago that showed what I looked like at 120. I weigh 131 right now.
I saw that post. So good.
I look way better at 131
100%
than I did at 120. Like, it doesn't matter what the scale says. It's all about how you feel. And that's what I tell people too. Like, throw the scale away. We need to know how much muscle you have and how do you feel in your clothes, right? So Absolutely. Like, if you have more muscle, you're going to feel better. So I completely agree. Like, DEXA is great. We've got to get away from this like number on a scale, and we've got to go to how much muscle do you have?
Absolutely. And I will tell you, look, I've had the honor and pleasure to work with some of the top fighters in the world, and still do. And sometimes, they got to make the weight. I mean, I won't even get into that. That's like, should be like a performance podcast. The way these guys lose weight.
That's a little different.
I'm like, oh my God, man. I'm like, they dehydrate themselves and do a bunch of crazy stuff. But as it relates to the prep to the fight, I'm like, dude, you're doing this thing all wrong. You're going to hurt yourself on the weight, how you're going to get to that weight. Because these guys actually have to make weight. Those are the only guys that I'm like, all right, I need to know your weight. But even so, there's a way to play with you. I want to get the fat off of you as much as possible and build muscle on you as much as possible, which is hard. It's hard as heck to build muscle like that.
I know. And so to your point with the GLP-1s, I just saw a post about this today. It's so true. Like, people come to you all the time, they want this magic pill. And I post about this. There is no magic pill. No. There is no cheat code. And that's the one thing I love about muscle is like, when I see somebody that's very toned and fit and like has a lot of muscle, I think to myself, wow, like that person has invested a lot of time in themselves. Like, they take good, it's the only thing in the world you can't buy.
No.
You cannot buy muscle. Like, you can't. And I tell people this, like, there is no cheat code. And so, can you take a medicine and it help you? Yes. But the thing that concerns me is if you take these GLP-1s, you've got to lift things that are heavy and you've got to change your diet. Because if you don't, you're just going to get skinny fat. It's kind of like somebody posted today. It's kind of like building a house on sand with rotted wood, right? As soon as the tide comes in, as soon as you get off of that, you're in trouble. And so it's so true with the GLP-1s. Like you've got to, there's a place for them for sure. And especially with physiology, with diabetes and lowering insulin, because it is very difficult to lose weight when your insulin is that high. So if you have this morbidly obese diabetic person, they benefit them so well because they'll bring their insulin levels down. And once their insulin comes down, they can start lipolysis better. They start losing, fat mass, which is great. But you need to make sure you're educating those people of increasing protein, lifting things that are heavy. And when they get to a certain weight, getting off of them.
Yeah.
Because otherwise, you're right.
I'm at a point, for example, where I feel like I'm so metabolically enhanced, and I'm kind of short. I'm 5'8", right? So and I weigh 195 pounds.
Okay.
So I'm pretty dense, and my fat mass is very low. I'm like on the DEXA scan that we use, the lowest I've ever seen was 14. Was a football player, and I'm 17 right now. So for a guy that works all day and so forth, I'm like, all right. But I have to lower the amount I'm eating or else I'll start to bulk up. And I'm 39, just turned 39 last weekend. So I'm like, wow, this stuff really works. And it's so cool, for my wife, for my parents, I'm like, wow, obviously you have to lift heavy things. You have to do the weights. And I'm going to go a little deeper, right? Because also, the idea with this is to, educate people on all walks of life. And, the fitness people that are out there, I talk to a lot of fitness people, doing some silly stuff, taking the wrong hormones, taking, stuff that, from what I understand, physicians can prescribe here. You never do that. But like the oxandrolones and the stanazols, also known as like anavars and winstrals and all that stuff, those hormones do hurt you. Those are not bioidentical. Hurt you in a slew of different things, so, there's a bunch of stuff there that, sure, it's get rich quick kind of schemes, but you're, deal with a mess afterwards. But for example, there's other things that we don't really pay attention to. And we spoke a lot about like sex hormones, but there's a hormone that I tell everybody, especially in the fitness space, you're sleeping on this hormone called IGF-1. IGF-1, which, also, works with diabetics pretty well because it's insulin-like growth factor, right? And it's this hormone, for those of you that aren't aware, it's inside your body. You could pull it up on blood work, right? You could do IGF-1 or IGF-1 BP3 to get some more detail on that hormone. And it's a hormone that looks like insulin, right? But it's not exactly insulin. It acts a little bit like insulin, but it also promotes growth, right? And it correlates also with longevity. There's some studies, like called the TRIM trial, one of the first studies on, not studies, but a trial showing that you could extend a human's age. I think it was 9 males they did this on. They used DHEA. They used metformin. I'm not a big fan of metformin, but to get the inflammation, sugar down. And then they used growth hormone. They used and the whole point of the study was it would actually help. I'm not going to get into this organ right now, but it would help the thymus gland to stop the involution process. That's a whole. I love the thymus gland.
Hour-long podcast.
Yeah, thymus glands are the best. But so thoughts on IGF-1 and fitness and aging and maybe diabetes. What are your thoughts on that?
So we lose IGF-1 as we get older. It's been shown, right? So the older you get, you lose IGF-1. It's made in your pituitary gland where all your other hormones are made. But I would completely agree with that. I see people who have really low IGF-1 levels. And, the stigma was for a long time, and I was in this boat. We don't give people IGF-1 because it causes cancer. It makes everything grow, right? But there are different types of IGF-1. And so the more homologous the IGF-1 is to what your body actually makes, the more just like it is, the better.
Can we say more bioidentical?
More bioidentical, yeah. The better it is. And I would agree, you take very small amounts of it. So when your body makes IGF-1, it's a pulsatile reaction, right? And so it kind of, I think of it as like IGF-1 is kind of, you're making it and you're storing it in your pituitary. And then there are certain times throughout the day that your body just dumps it when you need it, right? Right before sleep, or not right before sleep, but when you are sleeping, that's another time in the middle of the night, right? You need IGF-1 and growth hormone so that you can actually get good REM sleep. And so, yes, as you age, your ability to do that decreases. And so I am a fan of growth hormone if IGF-1 levels are low. I haven't used it a ton in diabetics yet. That's kind of a new realm for me, but I do use it a lot in the fitness world, right?
But I wouldn't say the growth, just the pure IGF-1 with the diabetics. I mean, technically makes sense in my head
Right.
if you kind of look at it. Not the growth hormone itself, because that will kind of raise sugar a little bit, right?
IGF-1.
But the pure IGF-1, I definitely think it's a medication that can, be applied to diabetics, and they're having all these other issues as well. So it's what I tell a lot of our clients and patients. It's about looking at your levels and playing DJ almost. Okay, and assessing them clinically, how they feel and so forth, to get them to their goals. And then adjusting lifestyle. Are you pushing the heavy things? What does your pantry look like? What are you cooking on? What's coming out of your shower heads?
How much are you sleeping?
Oh yeah, that's another one.
And it's like you said, so the thing that kills me is like, everything works together. So it's not like a stop shop. These hormone clinics that pop up and they give everyone testosterone. Like I had somebody messaging me about this last night. I'm like, that's not it. Like, so testosterone works with IGF-1. It also works with cortisol. It also works with your thyroid. T3 is very important. Your estrogen, your testosterone, your D, your B, your iodine. Like you have to look at it all together. It's insane to think that you're going to fix somebody or help somebody be optimized and feel well looking at one thing. Like that's nuts. It's not going to work. And so that's why I love, that's why I follow you. I love what you do, is because it's like the more knowledge you have, the better you can help someone, right? And everything works together. It's like this big circadian rhythm, and you have to make sure all of it is working well.
And I really think we're, we just met and so forth, and we're just giving it some broad strokes right now for everybody. But like, if you go deeper, some of the stuff, like we literally will test our patients, clients here for this, like, oh my gosh, I'm drawing a blank. What's the name of the Estrogen, for example. Estrogen is in the water, and it actually, in laboratory, makes male frogs attracted to each other, have sex with each other. Yeah. Actually, one of the gentlemen running for the president of our country has talked about it and is talking about it in his campaign. So won't say the name here just because I'm not trying to be, but
political. We're going to stay away from politics.
Stay neutral here. But yeah, one of them's talking about it. And we actually test our clients for that, and it's in our water supplies, and it does affect our hormones. It's what infamously is called an endocrine disruptor. Right. So sure, you could just go take your hormones, but
in food too, right? Like it's crazy to I won't even get started. It's crazy to talk about all the things we allow people to put in, or our country allows us to put in food, especially for kids, red 40, all these blue dyes, things that we know cause cancer, things that you cannot have in your food in Australia and in Europe. And those companies, they make things for us here, and then they take it out for other countries and send it there. Like, why are we allowed to feed it to people here? It's just,
you feel a difference.
My mind.
No, 100%. I was actually in Italy on a little family vacation, but maybe a month ago, and I was like, all right, here I'm going to allow myself to.
I saw that, to eat pizza. You ate pizza.
Yeah.
And you know what I told my husband? I said, he ate pizza in Italy, so that means we need to go to Italy so I can eat pizza, because I don't eat gluten here either.
Yeah.
But I was like, I told him, I was like, I want to go eat pizza in Italy.
Can I tell you something?
Dr. D did it, so.
I'm like, I was telling my wife, no, that day I pigged out. I said, I'm going to have one day. One day I'm just going to go ham. I'm not a big sweets guy, but I did go pasta this and pasta that and pizza this. And I told my wife, I don't feel tired. Yeah. I lift my shirt up. I'm not bloated. I'm like, what the heck? You feel a difference. And I did that because they do have, I don't remember off the top of my head, but I used to know the numbers. I've studied this pretty well before. There's a big difference in what they're allowed versus what us. And when you put all this together and you start looking at, I don't want to scare anybody out there. It's like, oh my God, we're being so poisoned. It's not poisoned. It's
sort of.
Yeah.
It depends on if you're eating Pop-Tarts and Doritos.
Yeah.
I mean,
the poison you're going to put, you're going to decide how much of it and what you're going to put in your body, right? I always tell our clients, I'm going to just educate you, and then I'm not going to sit here and patronize you. You're going to figure out what you want to do. Right. But it's also not about just like, oh, let me take my hormones and I'm fine and so forth. Yeah. No, because there's other big boys that are waiting for your body to get screwed up, like cancer, autoimmune disease, heart disease, and so forth. Sure, do your bioidentical hormones and, proper balance of things, of those hormones in your body help. But yeah, I always advocate do an environmental toxin test. I'm a big fan of that. That's kind of where I'm going with this. Do an environmental toxin test, parasite testing. There's so much gut tests. There's so much there. Like you really piqued my interest, by the way. I'm going to pick your brain with the estrogen and the microbiome. That's so cool. Like the stuff that's connected with that, and it's your responsibility. It's your health, it's your life.
Your choices.
Your choices,
And one other thing, the reason that you got to pig out and have all those things and you didn't feel terrible is because you have a lot of muscle. So I tell people this all the time too. The more muscle you have, the more carbs you get to eat. And you get away with a little bit more. So your wife and I were talking about this too. Like we both were saying how we eat more carbs now than we've ever eaten in our lives.
Oh, I eat a ton of carbs.
And you don't gain a bunch of weight because you need, like your muscles need them.
No,
right?
Muscle, brain, the whole no carb thing.
So like this morning I was doing Smith machine squats, like, cause it was leg day and I hate leg day, but I promise when I get in a bad headspace, I think every time I'm squatting, I think more carbs, you get to eat more carbs. You're doing this because you get to eat more carbs. Like it gets you through it, right? So the more muscle you have, you can do that.
No, it's funny because I was going to bed that night. And then whatever, I looked at my legs. I had never seen my legs. It looked like I just finished a massive workout. Yeah. I had veins and everything. I was like, what the heck?
Because your muscles took all those carbs and they were like, yeah, let's go. You're rebuilding.
That was insane. I was like, bro, I didn't work out today. And my legs were like, because it was a weekend. I don't work out on the weekends. And I was like, my legs were like, looked like I had just finished squatting a bunch, And yeah, that's a whole
conversation. You can't do that every day.
No.
But every now and then, yes.
So yeah, and that's another deep conversation just about carbs and dieting and nutrition. And yeah, because a lot of people are very carb averse. I am not.
I
eat a lot of carbs.
As long as they're good carbs.
Yeah,
right?
Of course. Yeah, good quality carbs. But yeah, that's a whole nother rabbit hole that maybe we can go down on another podcast.
And fat too. Women are in this mindset that they shouldn't have fat. Women need healthy fat.
Yes.
And a lot of times you need more healthy fat depending on the timing of your cycle. And if you deprive yourself of fat, it increases your cortisol. So that's the other thing I tell women. Like a lot of times women will tell you during their cycles, they have these terrible like hunger cravings and they're like, I want to eat the whole house. A lot of times it's because you don't have enough fat. Like take your omega, eat some avocado, have a little bit of peanut butter, it goes away. Like women need more fat at different times.
I didn't know that one.
Of their cycle. A good one. So a lot of women think everything has to be low fat. That's not the case.
No. Here our
and
clients
women need more fat than men. And so that's the other thing I see a lot of times. Sometimes when women will work out with trainers or nutritionists or something, they'll have them on this, high protein, higher carb, but they tell them like no fat. They're trying to lean them out. I'm like, you're killing them because their cortisol's high. And then that spikes their insulin and it's counter. I'm not saying give them a ton, but like you can't cut women's fat it's difficult for a woman to eat less than 40 grams of fat. And typically I say like 50 to 70, depending on their weight. I eat about 70 grams a day. I get hangry if I do less than 50. I have to have but fat's important too.
Yeah, the whole thing about not eating fats and, and with all due respect, a lot of trainers out there, they're going to put you on like bodybuilding type diets, high carb, high protein, and no fat, because the calories, it's like, well, hold on.
Your cortisol is going to go up. It depends on what you're trying to do, right? If you're trying to lean out and get on stage, yeah, I get it. You're going to drop your carbs, but you're probably going to drop your fat too. But in a normal, typical person, you need some fat. And by the way, it changes depending on your cycle.
That one I didn't know.
Because when your estrogen is high, that can so your estrogen and your insulin counterbalance each other out, and your cortisol and your progesterone. So if your cortisol is really high, it's going to lower your progesterone. And if your insulin's really high, it's going to lower your estrogen. And so depending on the timing of your cycle, like at the beginning of your cycle, your follicular phase, so from the day that you start bleeding until 14 days in, that's your follicular phase. Mm-hmm. Women have a lot of estrogen. We're supposed to. That's why women, if you fast, you feel amazing those first 14 days you can do it. Because when your estrogen's high, it drives your insulin down. But on the back half of your cycle, if you try to fast a lot, it's not going to be good because your estrogen's low, drives your insulin up. So it makes it harder to fast. Whoa. Same thing with your cortisol. So if you're not sleeping well, so let's say you don't sleep well for a few days and you're in the back half of your cycle when your progesterone's supposed to be high, if your cortisol's high, it's going to drive your progesterone down. It's going to make your symptoms of PMS worse. So there are different ways you can eat and fast based on your cycle. And so women, it's very important for women to know where they are in their cycle and just also know you build a lot of muscle in the front half you don't as much in the back half. So I adjust my workouts depending on my cycle too. And like, I just give myself some grace. So if I'm on day 16 of my cycle and I start doing legs and I'm like, this ain't working, I back down on the weight, eat some more carbs, like listen to your body, but your body will tell you that. And it may be in times when I'm stressed out. So maybe I didn't sleep as well or got something going on at work. If your cortisol's high, it drives your progesterone down. You don't sleep as well and you have more PMS symptoms. So everything is related, all of it. And so a lot of trainers don't know that either. And so if you're pushing a woman to do these things in the back half of their cycle and their cortisol is really high and their progesterone's low, that's where you get injuries as a woman. So it all goes together.
Let's go. Guys, have you ever seen this? Look, Dr. Cassie Smith. Yeah, look, fitness, endocrinology, dropping the mic on hormones, longevity, lifestyle. This doesn't exist. I'm telling you, I'm in the industry. I don't know people like her. So thank you so much for coming and rocking the house with me today. I really, really appreciate it.
Thanks.
And we got to do this again.
Yeah, for sure.
All right. Thank you.
The information presented, including any materials discussed, referenced, or linked within this podcast are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems, or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.